Fujitsu and Carea have a long-term relationship, and we've been able to understand what kind of challenges, what kind of issues the healthcare organizations such as Carea is facing. Public sector healthcare has a tremendous challenge, and it's based on the financial issues that there are, and there is a constant change needed.
Carea is a public healthcare organization, and it is specialized in special care and also mentally disabled people. The most important thing is that you get a fast access all the applications and data, and this is very important for the nurses and physicians when they are working. They don't have time to wait when applications goes up. They need the data information straight, very fast.
And now, based on that understanding, we have created a revolutionary end-user platform for them in order to help them to be more flexible, in order to help them to be more productive in the daily operations. We are utilizing the latest Citrix technologies such as NetScalers, XenApp solutions, and then added something more on top of those rock-solid platforms in order to be offering end-to-end view.
And that is why we use Patja Easy with Citrix. We create an access point to application and data. And we want to have this access point to be very fast, robust, very high usability and availability.
It's very important for a doctor to get into the data and the patient information as quickly as possible. They don't have time to wait for the applications. Time is money, but time is also much more. The fast applications give us a possibility to treat all the patients we need to treat every day.
Anyway, access is very important, and also the usability and availability. And with this Citrix solution, we are covering all these requirements.
Because security is so important in healthcare, you have to have a centralized information repository so that you know that where the information is located, who is accessing the information, what kind of persons are utilizing that information and why. And that's why we wanted to create a solution where the information is known, where is that located, and then we also know who is accessing that information. And simultaneously, we can enable the flexibility that is needed for a modern healthcare organization.
Normally, I work in different departments in hospital. For example, in outpatient department, and then in different wards, operation theater, and so on. So when I move from one place to another, I need my information which I need when I'm treating patient to come with me. So when I go to operation theater, it's very important that when I put my card in, the information I left behind comes with me, and I can continue from the first moment I put my card in.
One of the core ideas on Patja Easy is to allow the doctor and the caregiving personnel to spend more time with the patients and the people that are in the hospitals and the clinics, etc. And that's why we needed an end-user approach where you can always get the information that you need in seconds instead of minutes. The information flow will be smoother in the organization, and that's how the healthcare industry should look like in coming years.
I think the patients get better care if people are happier with their tools. So I want to give them better tools.
And that's why cost efficiency as well as the productivity are the key values that should be created for these organizations. And together with Carea, we've been able to show that, okay, this is the way how productivity and cost efficiency can be combined.